The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Once again, thank you so much for tuning in. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health right here in the Cayman Islands. And this time, it's something that we've talked about, and I'm glad to say that we are kind of re-upping on it. Consider it as Cayman's only independent accreditation lab. It successfully received their reaccreditation again. And I have to tell you, folks, I'm super happy about that. Go ahead and introduce yourselves to my public.
My name is Marcia Robinson Walters, and I'm the lab supervisor at HSA.
Yes, and my name is Martin Mckenzie, and I'm the laboratory quality coordinator at the HSA.
So when we talk about the idea of accreditation, how important is that globally?
Yes. But I must start by saying sometimes when you ask people what really is accreditation, sometimes it's this fuzzy idea they would have in their head as to exactly what accreditation is. But accreditation is basically, in a nutshell, where you have an international body who would actually give you formal recognition to say that you're actually meeting established standards. Mm-hmm. That's basically what it is in a nutshell. But in terms of the reaccreditation, I must say the lab, this is our fourth attempt.
Okay.
This is for the main hospital in Grand Cayman, and the third attempt for Cayman Brac. So it's two medical labs that is actually accredited under the HSA. The lab have to meet requirements that is outlined in the JCI standards. We have a new standard, which is the 2022. That's the latest. So we had to meet that standard. And some of the specific items we had to meet. The first one is international patient safety goals. That set of standards is a set of standards where you have to meet 100%, meaning that the impact on patient could be grave. So, for example, how we identify patients. It could have a ripple effect if you identify patient incorrectly. Maybe let's say at the point of entry to the organization or the first point of entry to the lab, they could have a ripple effect on the outcome. So that's just one example of an international patient safety goal. The other things we have to do is quality improvement and patient safety. We normally in this area would track what we call KPIs, which is quality improvement indicators actually. So we track a lot of quality indicators. For example, one could be hand hygiene and the hand hygiene compliance. So there's just one area of the quality improvement and patient safety. Then we have the other areas like prevention of infection and control of infection. This is one big area. For example, how do we decontaminate our surfaces, equipment, these kind of things, wearing of PPE. One of the big parts also is governance, leadership, and direction. And we all know we are governed by a board and senior managers, and they would set actually the strategic direction of the lab, set the mission, the objectives, and these are the kind of things we got to follow. Apart from them providing the resources, obviously.
Of course.
Then facility management and safety is another big one, staff education and training. We at the HSA, we employ only qualified staff and staff with the experience that is required for doing the job. And we normally set a mark of about 5 years experience. So we don't just, apart from the person being a local, anybody that's from overseas have to meet the requirement in terms of stringent qualifications and experience. Management of information is a big thing. Apart from the laboratory having an electronic information system that we will report stuff in and have our data and information stored in a secure way, how do we manage documents?
Okay, yeah,
So
the movement of the documentation.
Yes. So we call it document control, and it's just one big aspect of it. And last but not least is the quality control processes, which is all the things that we do to ensure that results are accurate and reliable at the bench level. So in a nutshell, that's what really it is in terms of the accreditation standards.
And that's a very very long laundry list of things to make sure that you get right.
Yes.
And you said something that I think resonated. At the point of entry, you have to start the process off at the correct way.
Yes.
In other words, the patient files, the patient information needs to be right at that point, because that ripple effect could be, detrimental down the road.
Exactly. And sometimes patient might become a bit irritable if you ask them to kindly verify your name and date of birth, even though we have that information, but we have to do that all the time. It's just part of the standards, and it's when you work in the healthcare environment, then you could understand that just that simple name mix up. A lot of people, for example, hear the name Borden.
Right.
And then you might very well hear Martin Borden when it's Marvin Borden and these kind of things. So they have to, at the point of contact, first point of contact for us, you have to provide a picture ID, and then we will still ask you to verify your name and date of birth from that picture ID, which is critical. And that's just part of the process. There's a whole host of other things that would normally go into that.
Yeah. And folks, put it into this perspective. A good example that we have a lot of juniors and thirds and even fourth, so you could have, Charles something Borden, and the only difference is the middle initial.
Exactly.
So you need to verify, and you need to hear and be concise. And a lot of times people could be, in pain. They could be, not coherent enough, or the dialect, or maybe a Spanish. So there's a lot of information that can go wrong. So you have to verify it so much.
You have to ensure, and it sometimes takes a little time. And the persons, they're in pain. They want to get help. But we have to ensure they get the quality health care that they demand and need. Yes.
Due diligence is very important, especially at this point in time. Definitely.
So if it might be said that we take time, we take so much time, but we're just ensuring that we're giving the quality that is needed.
Very true.
So we've been doing this for quite a while now. We've been going through the accreditation process for the laboratory. And we got our first accreditation in 2015. And we have been reaccredited. And this happened in 2018, also 2021, and now again 2024. So we're very excited. We have a very good track record of producing quality healthcare at the HSA. And not just for the HSA lab in Georgetown, but also for the Faith Hospital.
Excellent. Folks, we're going to take our first break and come right back. If you're just tuning in, we're talking about the lab Reaccreditation right here, as they have successfully moved on for I want to say several years. It's a positive thing when you hear the amount of times that you have done it, and it has never been a problem. It's always great to hear that. You're like, okay, we took the car in and it was fine. So thank you so much. We'll take 2 minutes and come right back. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be back in 2 minutes.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. We're talking about the Cayman Islands Pathology Lab in Grand Cayman, and also the one at Faith Hospital Laboratory over there in Cayman Brac. I don't want to take the thunder away from it, so I'll let my guests go ahead and reintroduce themselves. And I want to start a little bit with the history about how this came about.
I'm Marcia Robinson-Walters. I'm Lab Supervisor at the HSA.
Yes, and I'm Marcia Mckenzie, the Laboratory Quality Coordinator at the Pathology Lab HSC.
So we have a rich history, and Martin can talk. We've been going through this. We don't just get it in 2015. We had a long roadmap. And I can remember as far back as 2009, in the 1990s, we were working on accreditation for the laboratory. Quite supported, but it took some time. And we went through a number of checks and balances and ensuring we were meeting the right standards, because you have to be ready for that process. It's time consuming, it takes a lot of energy, it takes a lot of resources. And therefore, when we got that green light and the opportunity came, we were ready. We went forward in 2015 and we got our first accreditation in 2015. Mm-hmm. Now, even though we have a 3-year cycle, so they will revisit every 3 years. It's a continuous process. And coming back for the third year in 2018, which was our second accreditation, but they have different means of checking to make sure that you're following the standards throughout the years. Mm-hmm. They go ahead to call in and to do visits to ensure that you're meeting the standards.
Just blind visits, just, hey, we're coming in, just give you a heads up.
Yes, and you have to show the evidence, the documented evidence that you're meeting it, and also they'll question random staff. They'll question anyone that is there having anything to do with the processes to ensure that they know, and if they don't know, they will take it as they're not doing it.
Mm-hmm.
So we have a rich history of this accreditation in the Cayman Islands. 2015 and again in 2018, we have not failed any of these.
Wow. Excellent. Good track record.
Yes.
Good track record.
Yes. And if I may add, I must say, I came here from the Eastern Caribbean, right? And the thing is with Cayman is such a, I don't want to just say rich country, but it's a country that actually upholds standards.
Mm-hmm.
So when I came to the Cayman, I joined the organization in 2012, and I was actually wondering, why is the lab not accredited? Because the lab is so strong, and the quality was way up there relative to most of the other islands that I have visited. I think what the setback is that the lab believe in perfection.
Mm-hmm.
But if you go for perfection, then why then you would have the term quality improvement? So it would never be that perfect.
Mm-hmm.
But the lab was at that standard. The lab just needed a bit of fine tuning at that time, and just aligning what the practices were with the standards. But the lab was always strong, and the lab have a rich and long history of having quality in place. So I think the lab was always ready. It's just a matter of just taking that dive and to get it done.
Exactly. Let me just move to one question that I mean, you brought up an interesting idea, the standout accomplishments and achievements of the roles that you do to get that successful accreditation.
Yes.
Because as you said, it's not only a long process, it's a tiring process, and it's a process that you have to be perfect at to maintain that level. So let's talk a little bit about that.
So our lab is technically strong, and we are really proficient. And yes, that is proven and tested because we've gotten the accreditation. And we have strong pillars in governance. We're governed by a board, and we have to have different governance levels, and they have to meet the criteria in order for us to move forward. We have good leadership and management, and we have to ensure that there is lab safety, that there is proper infection control, and that all the quality processes are in check. We have proficiency testing, because this is testing where you just bring in blind specimen, and it's given to the persons who work on the bench.
Mm-hmm.
And they don't know when it's coming. They just know that this is a test they need to perform just like a patient. They don't know the answer. And then they have to produce that answer back to the external auditors. They get the answer correct. And if they don't get it correct, you need to meet a certain standard in order to continue to say you can run this test.
Okay.
So we have to meet all those checks and balances. And we have well-trained and competent staff. And as Mr. Martin mentioned before, persons who come in to the HSA lab has to have that level of experience and the qualification. And that is robustly checked. We have good instruments. When you look at our instrumentation, they are top line. And a number of suppliers can attest to that. When they come to introduce, we have already. So we have very good equipment and a very good information system. And from long time, a lot of labs might write on paper and all of that. We have a very good information system. And we have all the environment that is conducive to very good lab testing.
Exactly.
So, and those have to be top for you to get your accreditation. And when we got the visit, especially this time, the person that came, the assessor, was so impressed with our laboratory. And she said, yes, I'm going to take back some of these things to my lab so that we can do some improvement. Because she was really impressed with what we have.
Exactly. And I think that's one of the things that we need to be very conscious about. This is a day of information, and also, being able to operate on that high level, that scale. And this is something that you do daily, and it becomes the norm.
Yes.
And other people come in and they're amazed by the indications that you guys use, especially patient orientation wise, because you may say, okay, you know what, this makes it easier for us to attest to what we do and who we are. And that's a great way to look at it.
Patient care is at the forefront of everything we do. Patient care. Exactly.
Very true. And speaking of that, how does accreditation benefits the patients in the community? You kind of alluded to that a little bit, that is the ultimate focus, and all of the things that you do are based on that. Tell me a little bit more about that.
All right. I must say, Joint Commission International, or JCI, this is one of the largest accrediting body. So they're vast in their experience, knowledge, and skills. So to have that gold seal of approval from Joint Commission says a lot. And that can, in itself give confidence to our patients and the public at large. The thing is with the accrediting body, having a JCI accreditation, it demonstrates that, one, the governance structure of the organization is committed to quality. And once you have the top level personnel who are actually committed, then there's a ripple effect throughout the organization. They set the tone for quality. But in terms of the benefits, one, we're demonstrating that we ensure a safe environment that mitigate risk. Now, the new standards that we actually have to deploy throughout the lab is a whole risk-based approach now to quality. It's not just applying stuff, but we have to look through the eyes of risk and to mitigate our risks, whether it's be to patient, to staff, the environment. We also have to set and strive to meet quality benchmarks. We could actually set our own benchmarks, or the assessing bodies or the accreditors, in this case JCI, they could actually set benchmark for us in terms of quality and safety. Then also, we have to not just implement a quality management system, but we have to constantly improve on the quality management system. And as Marcia said, it's all patient focused. We have to keep the patient at the center of what we do, and that's actually enshrined in our mission also. We have to improve patient outcome and the patient experience. So it's not just about providing quality and all of that, but when patients come on board the HSA, what is their experience? Mm-hmm. So one of the things, we have to be customer focused. We have to be caring. We are actually guided by our core values. So we demonstrate things like respect. We have to be caring and all of these kind of things.
And not to interrupt you, but when you hear of a hospital talking about that, you don't. Most people don't say, okay, I'm a patient, but at the same time, you're a client. At the same time, we have to respect you. At the same time, we're just not throwing things at you. We have to tell you the ramifications. It's really a partnership that you're talking about.
Exactly. And one of the things we do, we have our patients involved in all the decision making that we do with reference to that patient. So it's not just a doctor talking to you or a phlebotomist talking down to you. It's a two-way kind of thing, and we involve patients and the family members in these kind of things. So it's all about the patient. And having this accreditation, it actually demonstrates our patients, our society at large, the community, that, hey, we have you at the center of all we do, and we're actually committed to all the processes and whatever is supposed to be in place to make you, well, happy, and comfortable whenever you come on board the HSA.
Very, very. Folks, it sounds like a very simple thing, but it's a very complicated process. Because when you think about it, as I tell people, the HSA hires literally thousands of people on there, and to make sure that everyone is the same, and then you take care of the community at large. So we have 70,000 plus people here on this island that you are realistically responsible for. Those are literally thousands of documentations. I just think of my personal file and how thick it can be over the years that I have been with HSA from a child to today. So those are things that you have to manage. You have to be able to reach at that at a moment's notice, and also in this day and age, make it secure.
Exactly. And you said complex, and it's complex for you, because how do you integrate your patients with your staff your environment, equipment, all these kind of things. It's a very complex environment while maintaining quality and safety. So again, this is where the standards come in. They would guide you through that and ensure that you're putting processes in place to ensure all these different requirements are met. So that's exactly what it is.
Mm-hmm.
Yes.
Very, very, very true. Folks, we're going to take a quick break and come right back. You're listening to the Healthcare Today with the HSA, talking with the folks here from the Cayman Islands Pathology Lab over here at Georgetown, and also in the Faith Hospital Laboratory over in Cayman Brac. They are the island's only independent accredited laboratories, and they continue to maintain their reputation, safety, and excellence by the JCI, which I'm going to ask them a little bit about that when I come back. If you don't know, that's the Joint Commission International, the standards that literally governs, I would say, the majority of hospital and clinics around the globe. Mm-hmm. We'll talk a little bit more about that. I had to do a little bit of research, folks, to look that up. So we'll be back in 2 minutes, all right?
Yes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health right here at the HSA. And we were talking about what the JCI is and their standards and how their accreditation process goes and why we have been accredited by them. And the JCI is Joint Commission International. So give me a little bit about that.
All right. How the process work? And before I say that, I must say in terms of what set our lab apart, we are the only medical laboratory that is actually accredited in the Cayman Islands. I think region-wide is maybe one other, maybe that's we talking, maybe I think in Bermuda. Mm-hmm. But what set us apart relative to the rest of the Caribbean and the region is that most labs, I don't even think is halfway there as yet. It's not that they're not committed to quality, but some labs are still struggling. And I think one of the things that set us apart is that we have a stable lab structure in that most people want to work in the Cayman Islands, was one. And our lab staff, in terms of our numbers and retention in terms of staff, is relatively stable. There's actually a global crisis now for medical personnel, so we find happening a lot of people, especially in the Eastern Caribbean and these places, they tend to move around a lot.
In transit.
Yes, so somebody who is trained in quality might be in one place for now and then tomorrow they're probably in the UK or the US. The good thing is, in terms, for example, the quality position in the Cayman Islands, the management position and techs, it's relatively stable. So there's one good aspect of it, and the fact that we are accredited, it goes to show that they set us apart. But how the process works is that you first have to acquire the standards. You have to decide on, do we go with JCI or do we go with ISO with standards? Now we think because JCI is one of the largest accrediting organizations, it's better to go with JCI. This one.
Okay.
They would outline the requirements in the standards. So you procure the standards and then you set forth plans as to how you will meet these requirements. And the thing is, before you could actually apply for accreditation, you must have a 6-month track record in terms of your quality management system. Having that 6-month track record, then you could actually apply and invite Joint Commission to come in. They would come in, then do the assessments, and after doing the assessment, then they would render you a verdict, whether you're accredited or not. Thereafter, they put you on what you call a triannual cycle. So every 3 years, they would be coming to visit and to conduct an in-depth and thorough survey. But we also must be mindful that the standards would change. They have different versions of standards would come out over time. So you would have to, acquire and then meet these standards as set forth by Joint Commission International. So it's basically a process whereby you apply for accreditation. They would send in the surveyors who are very experienced and knowledgeable people to come and assess the labs. You have to demonstrate to the surveyor that you're meeting the requirements of the standards. Then they would actually render you a score for all the different clauses in the standards, and then they would report back to the accrediting body, and then after some level of deliberations, then they would issue that gold seal. And again, so far, we have done exceptionally well. And wow, so set us apart. All assessors, when they come here, they say they have no hesitation at all in sending their samples to our lab for testing, because of they have that confidence in the quality and reproducibility and accuracy of our results.
And that's really good to know for our listening community, that the stability is there.
Yes.
Because I think one of the things that happens a lot of times is, and I think it's in most industries, other places look attractive, so the best kind of gravitates to where that is. Yes. And so when you say we are stable here is attractive, so we attract the best in the business. And, not only that our folks here rise to the level that makes it attractive to work, live, and be in this community.
Exactly.
So we get kind of the best of it all. Yes. for our public right here, for the public that's in the Cayman Islands. I think that is really great.
It is, and what it speaks to commitment to quality. It speaks to resources might be somewhere, but how it's allocated, and it speaks to, in the Cayman Islands, we just don't allot resources to anything. It is placed on health, and it's very important to our governance. Mm-hmm. We are governed, and we must say that we have the commitment from the governance team, from our healthcare directors and our managers, to dedicate resources to quality healthcare in the Cayman Islands, and that is commendable from the government right down. That is a big commitment, and that has been met so far.
making sure
And-
that the lab and all the entities to make it function are there.
and producing that quality healthcare. What we have to recognize also is that not just the JCI just don't look at the patients, at the community, but also the staff. Because if they recognize that the staff is not qualified, if the staff is not even mentally well, they look at all of those aspects. Because you have to, the HSA has to ensure that there's a culture of safety, which incorporates having staff well-being, staff safety, the environment around the staff,
the working environment.
the facilities. It incorporates everything. And some persons might shy away from allocating resources to these. And that is why we really stand out, because resources are allocated for these and taken care of. And that's how we could get that gold seal.
And I think that is a great testament to the governing bodies and also our and I say hierarchy because the politicians are also in
Exactly.
that they see the commitment and realize that, hey, we need to put resources towards this avenue, because you don't think about it, but if the work environment is not safe, the product is not safe.
Yep.
The workers aren't working in a safe. So how can the patients be in a safe environment? So there is a trickle down effect right there.
Exactly.
It's very complete. It's holistic. It's a very holistic approach to health, which is very, very essential.
Again, the standard is clear. If your staff is not healthy, that can impact patients. So you have to take care of your staff well-being just as much as you would take care of your patient's well-being. So it all goes together.
Mm-hmm. When did this reaccreditation take place?
So we had the surveyors coming into the Cayman Islands. It took place over a period. And you're looking at this period and saying, wow, they're with you like family for these 2 weeks or week and a half. So this took place from the 29th of January 2024 to the 2nd of February. So, that's a digging in and looking at our systems. And that took place between the two labs, between the Brac and the Faith Hospital Lab and in Grand Cayman. So that was the time that we were allotted for them to be here and digging into our system.
It's a very during those time frames, the renewal cycle is 3 years, right? Because you from time from time that accreditation till you're reaccredited is about 3 years.
Yes. So the survey will take place triannually. So they would come back every 3 years to do that drilling into the system.
Okay.
But they need to see continual improvement. And I must say that each time they come, they're looking for you to produce a higher standard.
Yeah.
Okay.
You are committed to quality improvement, not just having quality looking at your face, but implementing improvement strategies. And therefore, if you're not doing that, they will mark you down also. So we have to continually improve on what we had before and move to a higher tier, a higher level. Because in some accreditation systems, they will accredit you to a low tier, like say, okay, you're accredited to do these tests. And they call it different tiers. But JCI look at the whole process, which is why we were so happy that our governance team would say, our management team would look at JCI as the accrediting body that we use, because they look at the whole thing, not just putting us to say you're at this level to do these little tests, but they look at everything.
And when you say that, do they give specific recommendations on say, hey, the latest trend is this? Have you guys moved towards this, or are you planning to do this in the future? Do they make recommendations like that also?
They do.
Definitely.
They do. And they ensure, they would look at even how you utilize your test. If you're utilizing resources inefficiently, they will also give recommendations for that. And that is all outlined in the standards. And as Mr. Martin said, it changes from time to time. So you have to keep abreast with the different technology and the different instrument that is needed to complete your testing, the different parts, moving parts, because there are many moving parts in the quality essentials, and you have to be abreast with that and keep that technology going. So we got our lab, our hospital is accredited, but our lab is also singled out for that accreditation.
I was just about to say that because that's your lab is accredited through the hospital, but then specifically your lab is accredited on its own.
Yes.
Okay.
Because we that process took place before we got the hospital accreditation.
So it's really two. it's really two that you're looking at.
We were actually looking at it to say, well, look, the hospital is accredited, so it implies that the lab is accredited. But we came to the decision that the lab should have its own accreditation because of the fact that having your own accreditation for the lab, you go much more in depth into the different disciplines of the lab. So the lab have like pathology, hematology, chemistry, microbiology, and all of that. And they have specific standards for each department that the assessor would go into. Instead of just coming broadly under the hospital, covering broad policies, they have more specific policies. So for example, you might have 2 instruments in the lab reporting results. JCI would say, look, you have to do some kind of instrument comparison to make sure these 2 instruments are saying the same thing. That's what the lab standard would say. That might not be something in the hospital standard.
Okay.
Yeah, so they're more,
It's the difference between having an F1 race for my folks. Just hey, bear with me because I'll put it in layman's terms. It's the difference between having an F1 racer and a mechanic working out. Yes. He's still a mechanic. Yes. You still know it, but now you're getting into the fine tuning of what it takes to make this run. And it may be something that and folks, pardon me for being a little medical techie, it may be the difference between every 6-month cycle retesting the calibration of the machine versus, hey, we got a new one, it works.
Yes.
Okay.
Yes, that's how it is. So it's more, let's put some added layers of quality and safety for the specific departments.
Getting a little bit more specific with the ramifications on it. I think that is a great way to look at it, because what it does is it also puts you on say, okay, we need to doubly down and make sure what we're saying is correct, because we're going to get another accreditation to look at this. So it needs to be really on 100% basis rather than 98, 99, which would be great. We're happy with it. No, we want 100%.
Yes.
And I must say, it keeps the lab in speed mode, if I can put it that way, meaning because there will be the hospital cycle, which will come around, and then they have the lab cycle. So we always have to be at it. Always. We have no choice to let up.
I think that's a great place for me to ask this one question. I'm going to ask the question, think about it, and then we're going to come back and we'll start wrapping up. The question I want to ask is, how did the efforts of the whole lab team make this accomplishment? I'll give you a few minutes to think about that, folks. We're going to be back in 2 minutes. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Fridays and Saturdays at 1 p.m., we talk about all things related to your health. And at this time, we're talking about Cayman's only independently accredited laboratories, which is over at HSA, the Cayman Islands Pathology Lab, and right here in Georgetown, and also the one at Faith Hospital, Cayman Brac. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We're talking today with our wonderful folks over from the Cayman Islands Pathology Laboratory. Go ahead and introduce yourselves once again for my listening public.
Marcia Robinson-Walters, Lab Supervisor.
And Marcia Mckenzie, the Laboratory Quality Coordinator at the Health Services Authority.
So our pathology laboratories right here in Georgetown, also in Faith Hospital in Cayman Brac, are the island's only independently accredited laboratories, and they fall under the JCE, which is a Joint Commission International Standards, and they have just received another successful reaccreditation. And we were talking before we took the break about the efforts of the whole team, because there's a lot of moving parts there. There's a lot of I want to say ins and outs that people don't see to get to that information. Tell me a little bit about that, guys.
All right. I must say, this is always a holistic approach when coming to team, and without the team, we know that there won't be any success in what we do. So it starts from the board, and it filters right through to housekeeping. Mm-hmm. So we have, for example, the board, we all know we set our mission and our goals and our objectives and all of that, but then our senior management, which starts with the CEO, the medical director, the deputy medical director, the deputy CEO, and we have a whole host of individuals at the management level, including the lab manager. We have infection control coordinator, we have the health and safety manager, we have a quality and risk manager, then we have the lab techs, the phlebotomists, housekeeping staff. We could also include the nurses in here that play a role in point of care testing. Everybody have the roles and responsibility to play. Mm-hmm. One of the things we must add that actually was different this time around is that we actually added consultants who are actually physicians to sit over our technical departments. For example, we now have a consultant hematologist, oncologist, who sit over hematology as a consultant there and actually provide that extra level of quality and interpretation to our reports. We also have 2 microbiologists now that actually would work along in consultation with the microbiology department, and they also bring their expertise. So our results now, we can actually add, that kind of level of expertise and their opinions and all of that to the patient's results. So that in itself add a different layer of quality to our areas. One of the suggestions that the assessor made, because she was very impressed with that, one other area that we need to put a consultant over is chemistry. But from ever since, we had two pathologists in place that sit over histopathology and the forensics and these areas there. So the lab in itself is apart from being technically strong, is very proficient at what we do, and we lend that higher level of quality. But then again, it's a team that starts from the board right down to housekeeping. For example, you cannot take housekeeping for granted. They're the ones who will take care of the environment, the patient environment and all of that. And they of themselves have to be answering questions during their survey. For example, if they're using a disinfectant to decontaminate surfaces and whatever, they literally have to know what a disinfectant is, what was necessary PPE they got to wear, the protective equipment.
Right.
They also have to know things like the contact time. You don't just decontaminate a surface. How long do you leave the decontaminant on the surface and all of that? So, again, it's a holistic approach, and there's no way you can actually fail anything along that spectrum or strata.
Right. It's a completely, everyone is acting as one.
Yes.
To achieve the goal.
One oil machinery. That's exactly what it is.
Very, very true.
It is so interesting to see everyone at work, because even the facilities team, because if you have chip countertops and all of that, they're not going to pass you.
Right.
So our facilities team has to ensure that or even our countertops are.
And you say that, and I don't think of that till when you said, I'm like, oh man, so if something did get contaminated, it would go on. You don't think about those things as part of the process, but something as simple as that. So you have to make sure that your working area is immaculate. It is, as you said, free of chips, stains, and things of that nature, because those impact the results of what you're doing.
Yes, and you have your environmental aspect. So all of that is carried over into producing what we need to get from this. And I must boast that our lab tests and our results are indeed accurate because of all of this holistic approach and the teamwork and the team effort. We can say, thank God, we know that we are putting forward as best as possible the accurate and reliable results. And this is backed by our robust quality control process.
And I just want to say, as Marcia was saying earlier, why we choose JCI, some labs would choose ISO, and ISO would go on and they would accredit specific tests or areas in a lab. The Joint Commission International is all or nothing. So you can't be strong in one area and struggling in another area. So whether it's facility, whether it's quality, whether it's to do with safety, anything at all, you have to be, that strong in every single area. And for every test that you offer, you have to have all the processes in place to ensure that reliability. So there's one good thing about JCI. They will say all or nothing.
Very, very, very true. Folks, thank you so much for stopping by here today. Before we get out of here, I know you may want to give some kudos to the team. Go ahead and give them a last bit of wrapping up before we get out of here.
So we just want to thank everyone for, just supporting, and the community is also involved in this. When we have our accreditation process going on, the assessors would even look at patients walking in, at their response to the team, and ensure that the patients are happy too. So they might not have known that they contributed, but patients also were there contributing to all those who are in governance, all our leaders. We just want to say thanks to everyone for the support, from the board right down to the environmental team, to the staff. I know the staff sometimes that, when persons are looking on your process, you feel a bit intimidated. But they have such strength and they have resilience, and has been demonstrating that they are competent to work under these conditions. And they really support. Everyone come together, put this together, and we can say thanks to God. We have a robust healthcare system coming out of the hospital, and with the lab in the hospital doing such marvelous work, producing quality results for every test that we do for all our patients.
Yes, and I would just like to say, I would just want to say to the public at large, come down to the HSA, feel free. You'll see it's not just a place that is just technically proficient and quality oriented, but it's a very caring organization and make you feel like family. Mm-hmm. So you'll find when you come to the HSA, we embrace the patients, the family, we have them involved in all that we do in the decision-making processes. So at the end of the day, I think that's our focus, to make sure all of our patients feel at home when they're at the HSA.
Exactly. Very, very true. When you go there, you feel like you're being attended and taken care of by family. And that part is, I think, the allure and the understanding that what you provide is more than a service.
Yes.
It's more than it's needed. It is something full of compassion, with understanding, and also the technical aspect to keep this community safe.
Yes.
We stick by our core values.
Thank you.
Respect, responsibility, integrity, caring, and excellence.
Perfect. Thank you so much for stopping by here today.
And thank you so much for hosting us and having us here.
Thank you very much.
Excellent.
Thank you so much.
Keep it right here. This is Healthcare Today with the HSA. We will be back next time, another Friday, another Saturday at 1 p.m. We'll keep you up to date with all things related right here to the HSA.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.